simply not going to work because they make money on it and they pay legislators to support their positions. So what we've done is work with local farmers, and we work with groups who, how many know what CSAs are, or community source agriculture? These are people who are, they're small farms that are, they're called boutique farms, but they grow food organically, they produce it this way, and then they bring it to either a person can invest in this farm like a share, and then every week or so often gets a share of the produce that's harvested. And this is what we do. So this is how we provide access. What I do is I have this what's called a food prescription program where I give families or households vouchers for CSA. So they get a share of this produce. So every week they get a tub of fresh produce, and then they can, and then with recipes, and I have somebody go to the home and show them how to cook what they've just received, because they get things like kohlrabi or kale or who knows what, and they have no idea, they've never seen it. So they're taught how to prepare this food, and so it's a household, it's the children and families. So that's one way of doing it. The other is then connecting those farmers, because there's some large producers as well of good food, and connecting them with institutions, whether it's the school systems or healthcare systems or restaurants. And now a lot of restaurants are using locally sourced foods as opposed to importing foods from all over the country or even all over the world. They're using food that's sourced locally, and also looking at restaurants in terms of their vegan and gluten-free options as well. So now the consumer is driving that, as opposed to having it just being, people can be sustainable, they can be financially successful, they provide those options, and people are looking for that. And we have established a program with some institutions or restaurants that if they are these, what they provide healthy choice options, they can put that on their doors and say we can provide vegan options, and people seek that out. Or if they're local, there's also what's called local first, and so that's also something that this, as somebody, as a consumer is looking at, they'll go there. So instead of banning something, we're trying to promote that. So we're being a bit more proactive, and so because we don't want to get into the political battle with somebody who just can outspend us. What we're trying to do is drive it through consumer behavior.
I wanted to ask Kavita about. It sounds what you're doing is awesome, but that's very localized. Do you think that there's a realistic way to make that more nationwide and more accessible for kids everywhere?
So I really thank you for that question. So I look at our work very much as an incubator for what the rest of the Boys and Girls Club movement and all youth development can be doing. So to the best of my knowledge, I don't know another youth development organization, or at least Boys and Girls Club in the country, that has such a heavy emphasis in public health, or population health work. But I do think that this is something that has attracted the attention of our national organization. So the president and CEO of the Boys and Girls Club of America has been to our clubhouse 3 times in the last year, which is unprecedented. And he most recently mentioned us in his like national address at our national conference, and he shouted out Newark. And I mean, we are not a large operation. We have a $2 million operating budget. We're not particularly large compared to a lot of other clubs throughout the country. But what we are is really focused on responding to the needs of the community and thinking very much about innovation and partnerships. So some of the things that we're employing at the local level is talking to universities that are in our backyard to say, how can you become partners with us around our work in population health? So we're speaking to hospitals, universities, so we can expand our initiative. So bringing in doctors who will come in, because for us, trust is a really important part of the work that we do. We've been in Newark for about 80 years, and so how do we continue to foster trust with the local community and also bring the community what it needs? So we see ourselves as a conduit to that. So I think looking at our model, right now it's completely funded through charitable revenue. We want to move to a Medicaid model, and I think once we move to a Medicaid model, it'll pique the interest of other clubs throughout the country to say there's a sustainable practice here for us to be able to provide services that will greatly improve a child's life.
So ideally, it would move more from a nonprofit to public health stance, I guess.
Yeah, so we wouldn't necessarily support those initiatives, those three initiatives, specifically through charitable dollars. We would be able to also just use reimbursables, which is ideally the best way to sort of sustain that practice.
It's just one comment. I think what you're doing is amazing, but I almost feel in my heart you're reaching out to, what did you say, 1,000 children? And I just think of the millions. So how do we scale this? Did you address that? I'm not sure if I missed it, but the scale.
Yeah.
You
Yeah.
did you address that? I'm sorry.
No, 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 no.
Missed
That's
that.
okay. That's okay. So to scale it up, I mean, so there are about 4,000 boys and girls clubs throughout the country. And so we're the only one who invests in this. So I think a couple of things. One is that we need to find the sustainable revenue component behind all of our work in population health. So we're looking to move to a reimbursable Medicaid model. But what it has done is it's piqued the interest of our overall national movement. So I think that the Boys and Girls Club movement is the largest after-school provider for children in the United States. We serve over 3 million children a day nationwide. So being able to scale it up through partnerships, and I think what's beautiful about the movement overall at the national level is that it's easy for us to build partnerships nationally very quickly. So the fact that we're getting attention from our national office speaks volumes about how we can potentially scale this up. But for now, at the local level too, what we want to do is continue to foster relationships with universities and the hospitals in our local area. My vision is that the 2.0 version is that we have mobile units. So I would like to see a mobile dental unit and a mobile vision unit for our children, because we are in one part of the city of Newark, but the infrastructure within our city is so poor that public transportation doesn't really exist. So we want to go really out into the community even further and provide those services.
And can I ask Valarissa a question? Because Valarissa, I know, having talked to you before, that you've visited many countries, and so you've got a lot of experience of, real life situations. Can I ask you, what are the top three kind of issues that you feel we really totally need to address on a global level? I mean, you mentioned affordability, but you know, just give me what your view is on your experience of like the top three things we really need to all focus on
I think
in
for
helping the world. Yeah.
okay, so for one, it's definitely maternal and child health related issues, because when you start at the home, I mean, that's going to have the largest impact. If mothers don't have proper family planning tools, then we're going to continue to see some of these issues of like premature death, um, as well as just anything that related to health. If mothers aren't educated, then how are they going to take care of their families and their children if they're not going to have proper behaviors? Number two, there's still a lot to deal with clean water accessibility. I mean, think of water as a basic human right, and a lot of people around the world don't have access to it. Here in America, we have access to it, and we have access to hot and cold. But we still have issues. Look at what's going on in Flint, Michigan. I talked about this yesterday. A lot of people are just now hearing about it within the past couple months, even, but this crisis has been going on since April of 2014. And third, I think we just need to focus on a lot of diseases that are preventable. I mean, diarrheal diseases, and there's it's just centered around behaviors, washing your hands, just having tools within the household on a global scale. So when I was working with World Vision in Zambia, there was 5 things that I would go out into the community and make sure that they had. They needed to have a rubbish bin. They needed to have a dish rack so that they weren't washing their dishes and then storing them on the floor, where then animals are freely roaming and can, go to those pots and pans. They also needed to have like a pit latrine, somewhere where, it decreases open defecation. Because think about it, if you just walk off and you go to the nearest tree and you defecate, rainwater comes and washes that into your crops, diarrheal diseases. And then we also wanted to make sure that they had a tippy tap. A lot of times you'll go into these communities, and I would go into their homes, like, so how do you wash your hands? And there'll just be a bowl of water sitting there. And they just rinse off their hands and then keep going. But think about it, the water's now dirty. So we looked for sustainable ways of building all these facilities, and we would help the community if they didn't have the ability to do it themselves.
I want to thank you all very much, and I just want to make a final comment about the whole investment in public health, and it has to do with the investment is, of course, is something you would look at in terms of financial aspect of it. And those of you that have ever applied for grants or work for a nonprofit entity, you know the questions you're always going to have to be asked or answer is, to what degree is this sustainable, financially sustainable, and can you replicate this? So when I do this sort of thing, I have a brilliant team of biostatisticians, and I say to them, I want you to analyze these programs in that context and tell me to what degree is this replicatable to be scalable, because we have within our system, we have 17 hospitals. We operate in multiple counties, so we have a large geographic area. So I can operationalize some projects or programs within a certain area, and if it works, then I spread it out throughout not just the state, but then other hospital systems are looking at this, say, you know what did you do here? How did this work, and how can we do this? So I give them the model, because it's not proprietary. So I say, here's what it is, because my goal here is to have this sort of change, to create systems change, and that's the way to do it is providing a model that's financially sustainable, that's replicable, and is effective. And that's really how we make that sort of investment and change in public health initiatives. Thank you all very much. One more question.
As what we can do. I'm an American living in India, and what I've discovered is what can we do is really take a look at our food sources, because you come to India and they say, oh, you're going to get sick because of the food. Well, if you eat the food on the streets, that's probably the case. But I'll tell you, I've traveled to India in 2011, 2012, and now have lived here for over a year and never once got sick in India because I'm eating fresh fruits and vegetables. So when you were saying how many of you eaten produce, I was excited to raise my hand when you got to 5. I never could do that in the U.S. But the interesting thing is when I go back to the U.S., I am sick for 5 to 7 days. And because of, I think it's the additives, whatever it is. So it's so interesting when you live in a country where the water is jeopardized, but the food sources are better.
So just to add off that, I can definitely agree with her. My own personal experiences, I've traveled to many underdeveloped countries, but those were the times I was my healthiest, because like you said, I was able to access lots of fruits and vegetables. I'd buy tomatoes, and then within the end of the week, they're spoiling. Back home, like, I could get a tomato and put it in my fridge, and it could probably stay a month, and I'd be like, when did I buy this? Oh, it's so good, and start eating it. Also, like, I had access to lots of fish. Fish is expensive, like, really expensive. And if you're buying, low quality fish, then obviously that's cheap. But how healthy is it for you? I'm always sick in the